Thank you everyone for your patience. Good morning, good afternoon to everyone. Thank you for joining. We have quite a few participants already in. If you wish, you can, in the chat, greet each other, introduce yourselves, and then your organization and what country you're joining from. So welcome to this series of the thematic discussions titled From Drug Use Prevention to Social Integration in 2025. We're able to provide translation into English, into Spanish, thanks to Ana Gutiérrez. Just when you entered the webinar, you saw a sign to select the language, and otherwise you can also go to the top where it says More, and then select language and speech, and then you can choose your preferred language, English or Spanish. So if that doesn't work, you may need to try to rejoin the meeting using a Microsoft Teams web browser. We're excited to initiate these webinars with your participation. So my name is Sonia Putashadnev. I'm a volunteer at Association Proyecto Hombre. Oriol Esculies was meant to be the one to moderate today, but then unfortunately there are some connection issues that is affecting all of Spain and Portugal at this moment. So unfortunately, some of the organizers aren't able to attend. So I will be moderating the session in his place, and I'll be representing Association Proyecto Hombre and the Global Initiative on Drug Use Prevention, the Declaration of Oviedo. So today we will focus on the resolution promoting comprehensive scientific evidence-based and multi-sectoral national systems of drug use prevention for children and adolescents that was recently adopted at the United Nations Commission on Narcotic Drugs in March, and what role that governments, civil society, and academia can play in implementing this resolution. So the session will last 1 hour and 15 minutes, and it will be recorded in English only. Today we count on an outstanding panel, and each speaker will have 5 minutes to present their thoughts and remarks, followed by an open discussion. And we encourage you to write short questions in the Q&A box, and if we have time at the end of the session, we'll ask some of the questions to the speakers. We're pleased to start with Natalia Riffo, the National Director of the National Service for the Prevention and Rehabilitation of Drug and Alcohol Consumption, SENDA of the Government of Chile, whose leadership has been decisive in the adoption of the resolution. A psychologist from the University of Concepcion, much of her career has been linked to the public sector, where she has acquired extensive experience in territorial work, especially with vulnerable populations, as well as in promoting healthy lifestyles. Among other responsibilities, she was also the first woman to serve as Minister of Sport in 2014. And unfortunately, our interpreter, who was meant to interpret from Spanish into English, couldn't connect because she is in Spain and affected by the connection outage. So the speaker will be speaking in Spanish. Yes. Thank you. The floor is yours, Natalia.
Muy buenos días. Es un honor para el Gobierno de Chile poder compartir este panel hoy y comentar sobre la resolución que lideramos en el pasado periodo de la CND. Esta resolución llamada Promover Sistemas Nacionales de Prevención del Consumo de Drogas Integrales basados en la evidencia científica y multisectoriales para los niños y adolescentes. Se enfoca en un tema que creemos nos une a todos y todas: proteger a las niñeces y prevenir el uso de alcohol y otras drogas. La prevención del consumo de drogas trasciende el ámbito de las políticas públicas de salud. Es una responsabilidad compartida que involucra a toda la sociedad. El desarrollo de sistemas integrales de prevención, sensibles a las distintas etapas de la vida y a las necesidades de género y con un enfoque intersectorial, constituye una respuesta efectiva no solo para reducir los riesgos asociados al consumo de sustancias, sino también para mitigar otros comportamientos de riesgo. ¿Sigo acá? Sí. Ya, ok. Esta resolución se basó en un importante pilar: la prevención debe ser integral, estar basada en la ciencia e involucrar a múltiples sectores de la sociedad. En el centro de esta resolución está la comprensión de que la prevención no puede fragmentarse ni dejarse en manos de un solo sector. Necesitamos un enfoque coordinado que incluya a los gobiernos, a las comunidades locales, a los establecimientos educacionales y a las familias, al sector salud, a la sociedad civil y a los organismos internacionales, entre otros. Trabajando de manera coordinada se puede crear sistemas de prevención sólidos que sean inclusivos y que respondan a las necesidades de género y a la etapa evolutiva. En esta resolución también se enfatiza la necesidad de priorizar a las niñeces y adolescencia, plantea la necesidad de asegurarse de que las estrategias de prevención aborden sus vulnerabilidades específicas. En lugar de reaccionar a los problemas una vez que surgen, debemos invertir en iniciativas de prevención estructuradas y a largo plazo, comenzando en las primeras etapas del desarrollo y continuando durante la adolescencia. Esta resolución, en esta resolución se incluyeron varias acciones concretas, entre ellas, 1, fortalecer los sistemas nacionales de prevención mediante políticas científicas basadas en la evidencia y adaptadas a los contextos nacionales. Identificar y abordar las brechas en los servicios de prevención para garantizar que todos los niños, niñas y adolescentes tengan acceso a programas de calidad. Priorizar las inversiones en programas que han demostrado ser eficaces, asegurando que los recursos se utilicen de forma inteligente. Fomentar las alianzas entre los sectores de la educación, la salud y las organizaciones comunitarias para garantizar un enfoque coordinado de la prevención. Fomentar la adopción de normas de calidad en consonancia con las normas internacionales de la UNODC y la OMS sobre la prevención del consumo de drogas para orientar el diseño, la aplicación y la evaluación de las políticas de prevención. Solicitar a la UNODC que siga presentando asistencia técnica, capacitación y orientación para ayudar a los Estados miembros a mejorar sus sistemas de prevención. Permítanme finalizar esta presentación haciendo una breve referencia a lo que fue el proceso de negociación y adopción de esta resolución en marzo del año 2025. Chile presentó esta resolución porque creemos firmemente que la mejor manera de proteger a los niños y niñas es a través de la prevención y que es necesario reforzar aún más los esfuerzos que los Estados miembros desarrollan para la implementación de iniciativas de prevención basadas en evidencia. Durante las discusiones realizadas en las sesiones de la CND, pudimos observar que esta preocupación es una mirada compartida por la mayoría de los países que componen la CND. Fuimos testigos de cómo esta temática genera consenso y de que genuinamente existe un reconocimiento por parte de los países de la necesidad de seguir avanzando en mejores prácticas y programas para fortalecer el cuidado de las infancias. Si bien la resolución fue sometida a votación, fue aprobada por una amplia mayoría, contando solo con el voto en contra de uno de los países miembros. Reconocemos los desafíos que imponen a los gobiernos el uso de drogas, los nuevos mercados de drogas sintéticas, entre otros, pero mantenemos la convicción que la prevención sigue siendo nuestra herramienta más poderosa. Invirtiendo en programas basados en evidencia, podemos reducir los riesgos para que niños, niñas y adolescentes se promuevan también comunidades más saludables y fortalecer así nuestras sociedades. Si bien podemos tener diferencias en muchas áreas, este es un tema que debería unirnos a todos. La prevención es una responsabilidad compartida y todos tenemos un papel que desempeñar para garantizar que las niñeces crezcan en entornos seguros y saludables. Esperamos que esta resolución sea analizada y difundida en cada uno de los países miembros como una clara demostración de nuestro compromiso colectivo hacia la búsqueda de intervenciones en reducción de la demanda efectivas la generación de políticas de drogas más humanas y, en definitiva, garantizar no dejar a nadie atrás, como hemos propuesto en la Agenda 2030. Muchas gracias.
Thank you so much, Natalia, for your insights on the resolution. So now we move on to our next speaker. Dr. Wadih Maalouf, Global Coordinator on Drug Prevention Program at the United Nations Office on Drugs and Crime, Prevention and Rehabilitation section, orienting the drug prevention response globally. A good example of this is the coordination of the CHAMPS initiative to support amplifying national prevention systems. He has been working in the field of a health response to drugs for over 25 years, 19 of which have been with the UNODC. Wadih holds a PhD in mental health and drug addiction epidemiology from Johns Hopkins School of Public Health. Thank you so much, Wadih. The floor is yours.
Thank you very much, Sonia, and thank you for Oviedo Declaration for actually organizing this event that comes really timely in the scope of responses for prevention responses. And I'm really sort of sorry for the power outage.
Yo lamento mucho el problema de la energía que hay en España en este momento.
Yeah. So with that being said, I'm very happy to join
para continuar,
the rest of the.
Estoy muy agradecido de poder estar aquí.
With regards to the translation, Anna. Can you hear me now? I'm very happy to follow Chile, actually, not only during this presentation, but follow Chile also during the CND in the context of this resolution that we're discussing now, that just happened in March 2025. And I'm very happy to follow all my colleagues on the panel that sort of join from different sectors, maybe governmental, civil society organization, and institutions that have been supporting the quality of prevention, including Marica, thank you for joining, and Zili, supporting the quality of prevention globally. So I might be speaking in terms of the culture of prevention and the change of the landscape of prevention that we called it as UNODC, a new era in prevention in one of the web stories that we reported, but it is the result of collective efforts by the civil society organization and by civil institutions that have been putting that science forward for policymakers to really grasp, to change their appreciation to the science of prevention, their commitment to prevention, and most likely their understanding to prevention. But that commitment has been articulated in several steps that for us has been, that's why we called it a new era. The acceptance of the science of prevention has been growing significantly. For us, we started noticing it from 2013 when the standards of prevention were put in place for the policymakers discussing it. Aside the science of prevention, the context of a person-centered approach that moved away from just solely discussing the dangers of drugs and raising awareness and just messages of saying no to drugs, to really appreciating the larger set of vulnerability at the individual level, at the environmental level, at the microstructures that can be taken into account when prevention responses, and separating the idea of awareness raising from prevention in the larger sense that we can be approaching. More importantly, that how it reflected that it's a developmental approach. We can approach prevention in different ages of development, meaning that we don't necessarily have to focus only at the age where substance use is initiated, but we can start in very earlier ages of development. That developmental approach was also a key feature moved forward that really demonstrate when we really want to support a person developmentally from their birth onward, there is no way that one single institution can address that. That sort of opened the door for a multi-sectoral response. And this is where we started noticing that adoption of this concept and that frame of thought from 2022, when a resolution from the Commission on Narcotic Drugs came in terms of early prevention being reactivated and put into emphasis. Early prevention, not in the context of the timing of substance use, but in terms of developmental ages, that period from birth to the age of 8, 9, 10 years old. This is a missing gap in terms of investment in prevention that needs to be key, which was for us a very revealing step forward for the Commission in terms of really adopting that idea of prevention that's developmental. In 2023, we have put in place a call for action in terms of how to articulate that children-centered approach, because we talk about early prevention. 2024, in the context of the midterm review of the political declaration, the commitment of these member states moving forward, prevention was an initiative was put in that brings the multilateralism together, because also prevention was a key component that really is, this is where I like the statement of Chile mentioning that it is it's a topic that unites in a context of tense multilateralism. So we came in with this initiative called CHAMPS, Children Amplified Prevention Services, which is how to move to a multi-sectoral system of prevention that in a person-centered approach focus on the most valuable asset that we have, which are children, and how to amplify our current investment in prevention. Not only we do have now new tools that have been put to member states in terms of mapping out and maximizing on what sort of services that are available for prevention, services that not necessarily discuss drugs, but support children development, and how can we amplify it. But more importantly, this initiative was an initiative to demonstrate that this new modality can actually make a change in the lives of children, can demonstrate a return on investment, not only on drug prevention, but on many other sort of factors, outcomes that are linked to the same vulnerability, may it be violence, mental health, and beyond. So that political commitment is there. That political commitment has been articulated most recently in the adoption of this resolution in CND on multi-sectoral systems of prevention. So this is where it kind of firmed it down. Our member states really want to really showcase that prevention need to work in a multi-sectoral approach. Multi-sectoral meaning it's not only different sectors from the government that need to be implicated, but the civil society, the academic institutions, and the private sector need to be part of this. There are several sectors that can provide to this system, and there are several sectors that can benefit from these systems. So many institutions now have open source material that support on a sector by sector basis. There are tools that bring in the systems together. There are tools that amplify how not only the softwares, but how the hardware should work. The quality of the service provision, the service providers can be put in place in a more systematic way, legislation, environmental factors that really sort of strengthen these systems can be put in place. So now that this political commitment is there, these tools are there, it's an important point in time where we can sit together, and that's where I'm going to end up, to see how we can put our brains together to translate that political commitment into an investment in prevention that really can make a change in the difference. Articulating it on the ground. We have this meeting, and it comes very timely today to discuss with you all, but just to follow up on the 30th of April, we do have a follow-up with Chile and other member states, that all the co-sponsors of this resolution, to see how we can articulate it together. So basically anything we can discuss today are important insight that we can get from a larger perspective coming into the 30th, while we're meeting up with these member states, telling them, okay, what's next? So it's a very exciting time for us prevention-wise. I'm really happy to join you all, and I'm really happy to hear from you all how we can translate this action forward. And thank you very much again for the folks from the Oviedo Declaration for calling in this meeting and for putting in this declaration that is that very important call for action that really pushed the agenda as well forward. Over back to you, Sonia.
Thank you so much, Wadih, for your insights and your messages. So next, we're moving on to our next speaker, considered one of the founders of the prevention science. I'm very happy to introduce Dr. Zili Sloboda, President of Applied Prevention Science International from the United States. She has served in the faculties of Johns Hopkins University Bloomberg School of Public Health, the University of Illinois School of Public Health, and the University of Akron. Prior to this last position, Dr. Sloboda worked for 12 years at the National Institute on Drug Abuse in several capacities, finally as the director of the Division on Epidemiology and Prevention Research. She was a founder of the US and EU Societies of Prevention Research. She was trained in medical sociology at New York University and in mental health and epidemiology at the Johns Hopkins University. Thank you so much, Zili, for joining us, and over to you.
Okay, can you hear me now? Good, thank you. Thanks, Sonia and Wadih. I'm going to second what you said about how fortuitous it is and important that this resolution was presented. And I wanted to speak to the timeliness of the resolution. Over the past 30 years, the field of prevention science has matured sufficiently to provide the basis for a comprehensive system of prevention services that are grounded in a community, and that these services, when delivered with quality, in the words of UNODC, WHO, the international standards, would enhance the healthy and safe development of children and youth to realize their talents and potential and become contributing members of their community and society. So seconding what you said, Wadih, already. Prevention science has helped to identify the determinants of behaviors that protect or put at risk the social, emotional, and physical health of individuals, families, and communities. Prevention science also identifies the processes as to how these determinants operate, and understanding that how they operate and how they work for individuals. Prevention science has developed specific strategies that effectively intervene when the trajectories for individuals are negative, and in the case where they aren't negative, they can reinforce the trajectory so they remain positive over one's lifespan. And that is evidence-based interventions, a term that we use quite frequently now. It's nice for me to hear that almost every day, when in the past people used to go, no. However, there remains a great disconnect between what we have learned to date and continue to learn from prevention science about these evidence-based interventions and the actual practice of prevention in our community. We know that graduate schools in the United States and in Europe are now offering degrees in prevention science, and there's quite a bit of on-the-ground training programs that are designed to bridge the gap for practitioners. But today, the support of prevention research to further the science of prevention and practice, particularly to address new generations of children and families, remains insufficient. And it's kind of discouraging because we made so much progress over time. We need to structure, this is my dream, okay, sorry. We need to structure an international prevention research program that creates international teams of researchers and practitioners. They're trained together to further understanding the impact of behaviors on health and well-being of our children, and to apply this knowledge to development of a delivery system, building on what Wadih just said, a delivery system that I see as community-based, of prevention services, of a diverse range of prevention services to support a healthy development. We now have the opportunity to achieve this goal through such groups as the Societies for Prevention Research, both in the United States and in Europe. There's a group in the United States that was created a couple of years ago, the National Prevention Science Coalition. The Global Initiative on Drug Use Prevention, of course, and the International Consortium of Universities for Drug Demand Reduction, and the International Society for Substance Use Professionals. And I'm looking forward to opportunities for taking this idea and developing it further. Thank you very much.
Thank you so much, Zili. So next, we will move on to our next speaker, representing civil society. I am delighted to introduce Matej, the director of the Institute for Research and Development, UTRIP in Slovenia, and among other responsibilities, recently re-elected as chairperson of the Vienna NGO Committee on Drugs. He's been working in prevention and advocacy in the field of alcohol, tobacco, and other drugs for around 25 years, being involved in more than 30 European projects. He is one of the contributing experts of the European Prevention Curriculum published by the EMCDDA and the second updated edition of the International Standards on Drug Use Prevention by the UNODC and WHO. He has also just published his new book titled Prevention Gone Wrong. So, Matej, the floor is yours. Thank you so much.
Thank you very much for inviting me. I hope the connection will remain until the end of my speech. I'm at the Zurich airport, just between two flights flying to Portugal. Hopefully they will have internet connection when I arrive to Portugal. So thank you very much for invitation. It's a great honor to speak today on behalf of Vienna NGO Committee on Drugs at this crucial moment as we reflect on the new CND resolution promoting scientific evidence-based and multisectoral national prevention systems for children and adolescents. This resolution marks a significant step forward, but as with all commitments, its true impact depends on how we implement it. This is where civil society has one of the essential and irreplaceable roles to play. Civil society organizations are the bridge between policy and people. We are rooted in communities. We bring scientific knowledge, practice, experience, and human, including children's rights, perspectives into prevention work. Through our networks, we can turn global standards, including the WHO, UNODC, WHO international standards of drug use prevention, into real world action. To fully realize the ambition of the resolution and the past political commitments, including the resolution from 2022 on early prevention, I propose 3 clear and urgent roles for civil society. First, civil society must be champions of accountability. We must monitor the adoption, implementation, and funding of evidence-based prevention at the national and local levels. Using tools like international prevention standards, we can help ensure that prevention is not based on ideology, outdated myths such as scare tactics or just say no approach, but on science, equity, and respect for human rights. Second, we must be catalysts for innovative and inclusion. Prevention must start early and follow the individual through every stage of life, addressing not only drug use, but all related vulnerabilities. We must insist on the broader vision of prevention, one that integrates all dimensions of health, including mental health, address social determinants, and promotes resilience, particularly among the most marginalized communities. Third, civil society must be builders of partnership. The resolution rightly emphasizes the need for multisectoral systems. We have a proven track record of working alongside governments, schools, academia, law enforcement, and healthcare and social care providers. So civil society can convene diverse actors, amplify young people's voices, and ensure that prevention is woven into broader health, education, and social policies. At the same time, we urge member states to meaningfully involve civil society, not just as implementers, but as equal partners in policy design, delivery, monitoring, and evaluation. We call for political and financial support to scale up prevention efforts, with at least 25% of drug demand reduction budgets dedicated to prevention by 2030, as outlined in the Oviedo Declaration. Dear colleagues, science has shown us that much of the suffering caused by drug use is preventable. Prevention is not only humane and cost-effective, it's a moral imperative. Together, governments, UN agencies, academia, and civil society must seize the opportunity to move from words to action. Vienna NGOC stands ready to work hand in hand with all of you to build comprehensive, sustainable, and people-centered system of prevention, ensuring that no child, no adolescent, no community is left behind. Thank you very much.
Thank you so much, Matej, for your insights on civil society and their role in prevention. And now it is with great pleasure that I give the floor to Dr. Carmen Orte. She has a Bachelor of Science in Psychology and a PhD in Educational Sciences. She is the chair professor at the University of the Balearic Islands in Spain and is currently a visiting professor at Arizona State University in the United States with a Fulbright scholarship. Dr. Carmen's teaching and research activity and publications over the past 3 decades have been in the field of prevention of drugs, as well as other problem behaviors from the perspective of evidence-based family prevention. Thank you so much, Dr. Carmen. The floor is yours. If you could unmute your microphone. Now we can.
Now?
Yes. Yeah.
Okay.
Perfect. Thank you.
Okay, Sonia, thank you. I was telling that I am grateful to be on this panel with such prominent members of the international prevention field. And I take this opportunity to greet all of you. I want also to thank Proyecto Hombre to organize it. My intervention is contextualized within the framework of the 10 proposal of the Oviedo Declaration done in June 2023, and from the resolution of the United Nations, SENDA, specifically Session 68. The document, as you know, deals with the promotion of national systems of drug use prevention based on scientific evidence and a multi-sectorial approach for children and adolescents. As a member of the university from the last 30 years working on prevention, I think we can talk about the value of the university related in this case with this session. Our proposal and response are situated between the framework of the university and its responsibility in the training of our professionals who work and will work in drug prevention from different disciplines, services and agencies, whether they are governmental or not governmental. The university is a natural place to generate programs based on scientific evidence and the promotion of multisectorial approaches in childhood and adolescence. In this regard, the CND resolution contemplates many of the issues in which the university is corresponsible, and to which the document refers. Number one, the implementation of prevention programs based on scientific evidence. It should be recalled here that the evidence-based programs currently available to us have been generated, evaluated, and implemented basically from the university. The evaluation and strengthening of prevention systems, also in the document, we have to say that specifically with regard to the training of professionals, I mean basic training in undergraduate degrees and specialized training in master and doctoral degrees in health and social sciences career, and also in the identification of training needs of professionals in local and national drug prevention services, of course, in collaboration of these services and other agencies. Also, from the university, we can work in multisectorial approaches on the connection of the university with societies, organizations and services working in the field of prevention as part of the obligation of the parties that must work together. About the international cooperation, also, I have to recall that both through international cooperation offices, international services and departments, and among others, research collaborative projects between groups such university researchers working in prevention and scientific and social organizations in the same field. So, also, one of the main subjects of this session was related with scientific research and teaching in university curricula that train professionals in the field of health and social sciences. For me, and I think for other people that are working at the university, it is a matter in prevention, of course, it is a matter of introducing curricula content validated in prevention in different subjects, core and optionals of different studies in science and social studies, like a percentage of content specific to the profession and other content shared between studies in different fields of knowledge, including, as contemplated in the CND resolution, prevention systems must be adapted to the specific needs of each population. And all this with the collaboration of the United Nations Office on Drugs and Crime. So in conclusion, I would like to emphasize that prevention is the answer to the challenges facing today's society in relation to drug use. Investing in prevention with evidence-based programs and from the co-responsibility between administrations, including the universities, is our best tool for the promotion of healthy and protective societies for children and adolescents. Thank you all for your attention.
Thank you very much, Dr. Carmen, for your insights. Now we'll move on to our next speaker. So I'm happy to introduce Chantelle Pepper, Chair of the Western Cape Substance Use Forum in South Africa, with a degree in psychology and anthropology from Rhodes University and a postgraduate diploma in addictions care from the University of Cape Town. Chantelle is also on the board of the South Africa International Technology Transfer Center. She is passionate for real implementation of evidence-based prevention and one of the two focal points of the Oviedo Declaration in South Africa, alongside Alison Crosby, somehow representing here today the 174 country focal points around the world. Thank you very much, Chantelle, and the floor is yours.
Thank you so much, Sonia, for the introduction. And thank you so much for actually inviting me to be part of this panel with our esteemed colleagues. I always feel like I'm almost a junior, a puppy in terms of the field, in terms of my time being within the field. It's already over 12 years, but I feel still I need to learn so much more and incorporate what Dr. Wadih and Dr. Zili has spoken about, including Matej. And I'm really here just representing the Global South in terms of the developing nations, specifically Africa. The South African context. I'm based in Cape Town, Western Cape. We are part of 9 provinces, therefore 8. I'm responsible for the 1 province. And, you know, luckily, and we are blessed in South Africa where we actually have incorporated and have been incorporating prevention as part of continuum of care due to our national legislation that has been drafted back in 2008 already, where our act is the Prevention and Treatment of Substance Abuse Act. Of course, substance abuse was still relevant because the DSM-4 at the time was substance abuse, but we are amending that to substance use disorders. So we always strive to actually align ourselves with the UN, the international standards. But, you know, the crux of the matter is as South Africa, we really support the Prevention Oviedo Declaration, but it's all about implementation at the end of the day. And being within the field of substance use and having to be part of a provincial government, you quickly learn that it really is a whole of society approach. There is no other way of doing it. And I'm speaking about from the UN right down to the country, right down to the national and states or federal, for example. But then how do you trickle down whatever we, myself, as in the policy developers, you know, the implementers, how do we manage to trickle down what we know is evidence-based through to the municipalities, the stakeholders, communities, and becoming a sustainable intervention with the whole of society approach. Now, that's really my role in the Western Province. I have to work through the municipalities, through the mayors. Once I get the buy-in from the mayors, we then identify who their stakeholders are, who the community activists are, what community profile they have, their resources, and what type of interventions they currently have. So literally a needs analysis, a mapping of services, the mapping of the community. Do they have things in place? But then you also then need to understand that, you know, getting the buy-in from stakeholders, especially the mayors and the political leadership, it can take anything from 1 month to 6 months to a year or 2. I literally have struggled with various municipalities, and they always incorporate the biggest challenges they incorporate in terms of their interventions is really the understanding of what evidence-based prevention and treatment and recovery and rehabilitation is. So that's our role as well, on top of the fact that we have to be mindful of what national legislation determines what we can do or should do in provinces. So my plea to the UN and our UNODC colleagues at our regional offices is really to work closer with the provincial governments, because we are the implementers of national legislation, as well as the what we all agree at as member states at the UNCND. So in a nutshell, we have lots of examples in Western Cape of how we've incorporated a multi-sectorial approach, the whole society approach. The city of Cape Town has done very well in that, in its incorporated the Strength in Families program. Also, our sister department of Health and Wellness, together with UCT, University of Cape Town, we've then now outrolled the Planet Youth in one region, at one school, at 3 schools. We then rolled it out to 18, and now we are in 123 schools within the Western Cape province, meaning that as Department of Social Development, we cannot do it alone. I would like to highlight how partnerships, collaboration of this nature is key if we would like to ensure evidence-based prevention intervention is established as well as expanded within the communities, wherever you may be. So those are the 2 key things that I would like to highlight, how from a CND level, how it trickles down to how each country needs to ensure that the legislation is aligned to the CND resolutions, but then also how do the provincial and local authorities incorporate that into the councils and budgets in order for us to actually do the necessary evidence-based prevention programs that is much needed within our communities. And therefore, I'd just like to say that working with funded organizations like our civil society, that's also one of the key ways of actually, like Matej said, delivering the much needed prevention services. And etiology model in terms of the prevention science, we really need to focus on the micro and the macro levels, and therefore different interventions can be incorporated at various levels, but in partnership with your municipalities, your stakeholders, your provincial and national governments, as well as, don't forget, correctional services, justice, and basically the whole spectrum of what we know as working together as a whole of society approach. So the schools also is a key critical component with children and adolescents. And the reason is that our South African Medical Research Council always highlights that it's about approximately 20% of people that are readmitted to inpatient. So if we can address and really focus on focus on prevention, I think we need, therefore we can reduce that readmission rate as well, putting things in place, increasing protective factors, decreasing risk factors, at a family, school, the micro level, as well as the macro level, as Dr. Zilla taught as well. So for me, I really feel that school interventions really play a key role so that we can also, adhere to what we as a country has committed to at the CND level. And I think Ms. Alison Crosby, who is the other focal point for South Africa, unfortunately, it is a public holiday in South Africa. So unfortunately, we do not have many South Africans joining this call. I asked Alison, but unfortunately, she already had plans. But just to highlight in end of esteemed colleagues is that Alison is a really great example of how an organization, a funded organization, has really taken what she has done over the years at the schools, within the school system, working with teachers, principals, changing the policy in terms of drug policy, that she's now incorporated the prevention leg of it, and she received the Universal Prevention Curriculum training, and now certified trainer. But also it boils down to how we can actually get national to really see what the provinces are doing. And I just like to end off like Dr. Wadih. We had a meeting with him and his team in March. We became aware of the CHAMPS program, but we then just requested some clarity around it so that we understand what we as a province need to do in order for us to receive that or to get that CHAMPS program at our province. And of course, Dr. Wadih advised us we have to go to the national level. You know, and that's also kind of also sometimes for the provinces and the local authorities, that creates also sometimes barriers because we are ready. We know what our communities are needing. So to get the buy-in from national is also just yet another step of what we as policymakers and implementers need to be always mindful of, and the political scene as well, so that we can, and I'm so blessed to have the political leadership backing us, you know, really giving us support, as well as my head of department. So having the political support, having the leadership support, as well as the buy-in from national, so it can trickle down to the provinces and the local municipalities and their stakeholders, as well as the communities. I think that's really going to really give us that what the CND and Dr. Zille, the prevention science, really is promoting and advocating for, is that we as implementers, we really also do need assistance. So if Dr. Wadih can really assist us at that level with getting the buy from national, you know, that is what we are trying to do as a collective. So I really do believe it's a collective effort. And I'm really happy and proud to be here on this panel. And I really would like to strengthen any relationships. And then therefore, my commitment to Dr. Wadih was that we will get a meeting with our national colleagues. And I say it again, I will make that happen. And now is the time. So thank you so much for having me. And we did miss Oriol. So, and he's the reason why I am here as well. Thank you so much.
Thank you so much, Chantelle, on your message and your insights in the context of Africa and the Global South. It's very interesting. And now we'll move on to our final speaker, Dr. Marica Ferri. She's Italian, based in Portugal, and it is a privilege and means a lot to end this panel by listening to her. She is the head of the sector of health and social responses at the European Union Drug Agency, the well-known EMCDDA before. She is one of the greatest experts in epidemiology and evidence-based medicine. Before joining the agency, Marica coordinated the Cochrane Drugs and Alcohol Group and oversaw developing evidence-based guidelines for public health at the Public Health Agency of Rome. She's also a doctor in public health, among other studies. She is a passionate lifelong learner. Thank you very much, Marica. The floor is yours.
Thank you to you, Sonia, and for the organizers to have me today. I think the fact that this webinar is going ahead so well under problems of the power cut on the side of the organizers is really perfectly represents how the people committed on prevention is able to be resilient and to overcome all the obstacles. As it has been said before, I'm here working at the European Union Drug Agency. And we are lucky in Europe that we have the framework of the European drug strategy guiding us towards main principles. And of course, the declaration and the CND resolution are aligned with these main principles. What I really appreciated is the fact that it has been said before, prevention is uncontroversial. Everybody agrees that it's important to make prevention, but not all the type of preventions are good. Prevention can also be very harmful because it addresses young people, people that may not have yet the critical capacity to understand. So we need to be very, very careful, and good intentions are not enough. So I think this resolution is of particularly importance because it highlights this need for intersectorial efforts. Good prevention can make a lot of work, not only on the public health side, but also on the safety and the security. So we know that a good investment can really give a lot of return of investment, to use the economist language. So we need to help decision makers, good intention decision makers, to make the best use of their resources. We know that sometimes these resources are limited, and we can really help. How can we help? First of all, like sharing the evidence. It has been said before, it is a science. We need to make sure this science is digestible, translated, available for everyone in need of it. Secondly, it's important, and it is in the resolution, that prevention is one aspect of the general responses to drugs-related problems and beyond. So our ambition, for example, in our agency, in the health and social responses, is to provide entry point for people wherever they are to be able to give the best of their potential to the society. We're always remembering that individuals are not isolated. We need to invest on the communities. The communities are the ones that can help individuals to develop. People shouldn't be alone with their own responsibility. We live together. We can develop together. What can do our agency to support implementation of this initiative? We have tools for dissemination of evidence. One is the well-known best practice portal, the exchange database of evaluated prevention programs. We are working on better data collection to be able also to improve the evaluation and the outcomes. And we have the training available, training coming from elsewhere that has been adapted to the cultural context. And I think this is also very important, to be able to translate the global evidence into locally meaningful interventions with the help in co-production with the people living in the specific context. The quality standards are also very important. They help people working in the field to prove the effectiveness of their interventions, to standardize and to learn from each other, from the good and the bad experience, to become very transparent about the continuous learning process. So what I think we need to aim to is to increase our synergies. Is not acceptable that we multiply or we duplicate the efforts. We need to learn from each other experience and to optimize the resources that we have at our on our side. So I think this is the main message. There would be much more to be said. It's very inspiring to have listened to all your interventions, but I think I want to reduce my space to give room to other comments and listening more than speaking. Thank you.
Thank you so much, Marica, for your insights and your messages as well. It was all very interesting. And so I would just like to open the floor again to our speakers. If there are any final messages anyone wants to share or add after all the speakers have shared their messages and their insights, if anyone has anything final to share. So I check in the chat. I haven't seen any questions yet, but we will share the recordings with everyone after the webinar finishes. Oh,
there is one. Sorry, Sonia,
hand.
There's a hand.
There's a hand by Natalia.
Oh yeah, Natalia, you can unmute and.
Hello, you can hear us?
Yes, we can hear you.
We just wanted to end our words. We're very proud of conducting this resolution in the CND. We are very happy to see how all the countries and different sectors are involved in this discussion. I think we have furthermore to discuss, and also I think, as many of you said before, we have to get into action. You know, it's the political commitment is there. Prevention unites us all, but now we have to go into action. So I'm looking forward to work with many of you so we can improve our prevention systems. Thank you very much.
Thank you.
Thank you very much, Natalia. So if there's no other, if there are no questions in the chat, just close. I would just like to conclude the webinar. I wanted to thank our wonderful speakers who covered the importance of civil society, academia, international organizations, local and national governments, and their role in implementing and strengthening prevention systems in policies and services. And they highlighted the importance of collaboration, exchanging knowledge and experiences, and for there to be a multi-stakeholder, holistic and multi-sectoral approach to prevention. And it was all very inspiring, and it showcases the work and the determination that I think all the people in the different sectors and organizations have to together work towards improving prevention globally and also locally for communities. And as a young person myself, it is very happy to see that we are working towards improving the world to be a better place for the next generation. And thank you everyone for joining this webinar. We will send out the link of the recording afterwards, and we will inform you all of our upcoming thematic sessions that we'll be organizing throughout this year as part of the Global Forum on Drugs. And I just wanted to apologize again for all the inconveniences and the delay in getting the webinar started. And thank you all for your patience in my moderation. And I would like to extend our thanks as part of the Organizers Association, Proyecto Hombre, and the Declaration of Oviedo. And we thank you all for your continued collaboration with this ongoing initiative and journey. And we're very happy that you're all part of it. And thank you all very much for your time and your efforts and work that you're all doing. Yes. Thank you so much, everyone.
Thank you so much, Sonia and the team.
Thank you.
Have a blessed week ahead, everybody. Thank you.
Bye-bye. Thank you.
Bye.